It's time to enhance the relationship between expertise and impact, between knowledge and application. Welcome to a journey of discovery and empowerment. Welcome to All Physicians Lead, the Forbes Books podcast that highlights the critical leadership role that all practicing physicians take on every day. Here's Dr. Leon Morse.
Our guest today is Dr. Stephen Jones, President and CEO of Inova Health System, a leading nonprofit healthcare provider in Northern Virginia and the Washington, D.C. metro area. A board-certified urological surgeon and professor of urology at the University of Virginia, Dr. Jones has an extensive background in healthcare leadership, having previously served as president of Cleveland Clinic Regional Hospitals. With a strong commitment to advancing the quality of patient care through teamwork, he has been instrumental in driving improvements in outcomes and fostering a culture of collaboration among healthcare professionals. Dr. Jones, welcome to the podcast.
Very much appreciate the opportunity.
Good to see you again, and appreciate you taking the time. I know you're incredibly busy, so the listeners are going to very much enjoy and benefit from your insights, so thanks for being here. So one of the questions we like to start off with is a little bit about your journey. Medical school, urologist, physician leader, academician, surgeon, now CEO of a very, very large healthcare system. How did that transpire? What were some of the motivators and branch points, and how did you make those decisions?
Actually, quite the accidental physician leader, although I love your phrasing, all physicians lead. And so I think that's a very true case. But, I grew up on the banks of the Arkansas River as a farm kid. And at some point, as I had the opportunity to have a teacher who got me inspired a little bit by science, and a mom who pushed me a little bit more than I would have pushed myself, at some point asked, well, why don't you go to medical school? And I think only met two doctors in my whole life, both of whom had put sutures in me for things that happened to kids that age. So I didn't have any background, but it turned out to be an incredible match. And as I went through that journey, I love clinical medicine. And I had opportunities along the way several times just to get involved. From early career, I had come out when lasers were the new technology, which now really dates me, of course. But I was
remember that.
I was the one who was trained in it. So they needed somebody starting the laser committee. I'll do it. And then when I got to Cleveland Clinic at one point, somebody asked we wanted to start an OR efficiency committee, which in retrospect means it was only telling my partners they couldn't use expensive stents. So it wasn't that great leadership moment. But I think for any leader, saying yes to the right things and then performing is the key. And at some point you look up and you're responsible for a lot of things, but it's literally been along the way saying yes to the right opportunities and making sure that I could execute successfully on them and learning how to deal with people, because ultimately leadership is 100% about people. So learning how to deal transparently, candidly, directly, and thoughtfully. And by the way, know that you're not going to be right all the time.
That's a great philosophy. And certainly, we talk a lot about that if there are 5 people standing around and you're the one that raises your hand, you're going to learn something and you're going to be able to contribute to the organization in a positive way. So appreciate that story. We also talk a lot about the fact that all physicians have influence. They're leading, in effect, at every level. What are your thoughts on that concept, and what messages do you have for doctors out there who would listen to the podcast and take that message?
Well, if you don't want to lead, you shouldn't be a doctor, because you in that patient interaction, the patient needs you to lead. It's not that you're telling them hopefully what to do, but leading them towards a better outcome. That's what they come to you for. You didn't come to them. They came to you. In your individual teams, that position is always going to be in that position. And so as you and I have spoken over the years, I very much lean into that concept of your leader as a physician. If you want to be a formal leader, that's a whole different thing. And that requires a commitment. It requires, to your point, saying yes and learning from that. It requires developing ourselves. I think intentionally learning to lead. I met someone recently who told me something I thought was just brilliant, is that if you want to be a formal position leader, it's almost like doing another residency. You spent, Leon, how many years learning to be, not only a neurosurgeon, but a pediatric neurosurgeon. incredible amount of time to learn that. And at some point you get extremely good at it, which I happen to know directly. The same token, as a leader, you get that. And, if you take the neurosurgeon, or for me, urological surgeon journey, there's a point where I wasn't great at tying knots, and then I got really good at it. And as a leader, there's a time where I wasn't, good at having a hard conversation with someone to help them understand that they can better themselves. And then you get good at it, but it doesn't happen all accidentally.
Yeah, that's great advice. Oftentimes folks are asked, what does it take to be a good physician leader in healthcare? And when I hear that question, I actually kind of step back a little bit, because healthcare isn't this homogeneous environment where everything's the same. So if you think about all of the different venues where patients exist, teammates exist, physicians exist, what do you tell folks about their leadership style, how it varies and how you adapt that based on the moment that you're in?
Let's start with the complexity that you described. Peter Drucker, who's arguably the father of modern business, described, quote, the modern hospital, so we're talking about one hospital, as the most complex business that exists. Well, that was before hospitals were systems, before multiple specialties arose from that, all the different things, including supply chain things and all that we deal with now. So if you describe it as the most complex, then it's not hard to figure out it would be the most complex multiplied at this point. Down the lines of specifically becoming a physician leadership, I think probably more than any other field of leadership, credibility matters. If you don't have clinical credibility, it's hard to be regarded as a very strong physician leader. That's one of the reasons why I encourage as many physician leaders as possible to stay clinically active. It is a calling card that you've got that helps you deal with aspects of the business that those who don't have clinical expertise just simply can't understand. By the same token, those who came through a non-clinical approach, they learned some things that we didn't. They learned things in business school. They learned things in jobs in their early 20s when we were in residency, trying to figure out how to tie knots or whatever we were doing. So that credibility is something I think specific to physician leadership. Excellence, I think, is really important. Commitment that you really want the very best outcome for patients. And the only way that happens is by having the teams around you, would be the second one I would add. Third would be empathy, understanding what we do isn't making widgets. It's actually human beings. And I think that when people get too close to the widget piece, it starts deteriorating your ability to develop excellence, because you don't understand these are human lives that we're dealing with in a moment of their greatest vulnerability. So that would be the third one. And then fourth, I think, hopefully ties all that comes together, which is authenticity. You've had a lot of people who want to, well, I'm a surgeon, but now I want to be a business person. Well, no, you got to be you, or you won't be successful in either of those. And so authenticity, as hard as it is to embrace, is actually in many ways, I think, probably the strongest leadership trait to pull those other pieces together.
Yeah, and it builds trust, right? People don't worry that you're a facade and that you're going to change tomorrow and present a different face. So that's really neat. You talked about the patient at the end of it, and I think we've talked about this before. I would walk around with all our teammates, and whether they were in finance or HR and legal, and say, "Hey, thanks for taking care of patients today." And they'd say, "Well, I don't take care of patients." I said, "No, yes, you do. And better than most how much we need all of these professionals to be able to, put knife to skin, as it were, and reminding them that they contribute to that patient every single day, thousands and thousands of times, is, I think, very, very beneficial."
Yeah, I think that's so true, because every Monday morning I onboard all new team members. Unfortunately, it's virtually these days. And I make clear, if you're in our system services where you don't take care of patients directly, that child doesn't go home healthy that Dr. Moore is operating on, unless he had the people around him, unless he had the infrastructure, he had the technology he needed. So yeah, he's got specific surgical skills that you guys aren't going to have, but he can't practice those skills unless you all pull together and make it happen. And I ask people to let their families know, even if you're not direct clinical, you are responsible for that great outcome that you heard somebody talk about.
Yeah, that's awesome. And I think people take that to heart. I've had folks come back to me and say, that meant a lot, that recognition is there, that, we have a very honorable mission. And I'm not detracting at all from folks who are making automobiles or building computers, but everybody in our system is helping people live better, healthier lives and sometimes saving lives. And so I think it's easy to get behind that mission as I know you do. Any examples that you've seen over the years? We make the argument here that effective physician leadership affects patient outcomes, specifically, as my Navy colleagues would say, at the deck plate level. That frontline physician making a difference in how patients receive their care, comply with their therapy, and listen to the care guidelines. Does physician leadership, in your opinion, impact that, and how?
100%, of course, is the easy answer to that. I think that where it really matters is the physician identifying the entirety of what it takes to have that clinical outcome, and then what needs to happen. And that's not always real obvious. The physician might say, I just need a more expensive tool. Whereas realistically,
do they say that in your organization, our organization?
Every day. I'm curious. You're probably going to be asking for some budget thing now.
Maybe
right?
at the end of this hour. Yeah. But he's on to me. Oh no.
Don't worry, we'll get approved probably. But if you think back at times where it really stands out, for example, some of our physician leaders came forward early in my tenure at Inova and brought forward the concept of having a daily safety huddle. Well, now I had some familiarity with that, watching it around the country. In many organizations, a daily safety huddle kind of becomes an exercise in kerfuffle that people, start trying to point fingers, and they start trying to find explanations, and then they make sure that by the end of the day, they can tell somebody that that's been resolved because they want to, check off boxes and look good. Whereas, we had a number of safety leaders, here, Dr. Steve Motu, Dr. Chappie Venkatesan, some others who came forward and said, no, we don't want all that. We want to actually get system leaders together every day to figure out the safety issues that we deal with to make sure that tomorrow we're safer than we were yesterday. And I was resistant, but those leaders made the case. We're not going to have it be, box checking and chasing down things. We're going to be solving things. And so, every single day, Inova senior leadership gets together, usually somewhere between 30 and yesterday, because we were dealing with the specific IV fluid shortage on the day before we made this recording. The bottom line is there are about 80 people who were on that, just problem solving and figuring out and going in back with authenticity and back with not always having the right answers to make sure we could get the right answers and resolve this. And as a result, our safety numbers are, second to none or second to very, very few, because physician leaders brought forward that. We had a case of a baby born at Inova Alexandria Hospital not too long ago that there was a quick recognition there was something wrong in the baby's chest. Well, it turns out we quickly resuscitated the baby, got that baby transferred to Inova Fairfax Hospital. Within a matter of hours, Dr. Clauso and members of that team were in that baby's chest removing a teratoma. For those of you non-clinical, it's a benign tumor that was, looked to me on the photograph probably as big as the baby's heart would have been. That all happened because leaders got together and created a system where we wouldn't just have a baby at a hospital and say, that's okay, that hospital's problem. It's a system came together to make sure that baby went home days later healthy. And, to my knowledge, will live a long, healthy life because physician leaders pulled together a system that worked for that baby.
Yeah, great story. And we see that over and over and over again. That's awesome. The idea that we talked about earlier, sort of volunteering, putting yourself out there to begin to develop your leadership sort of on the fly. Any other suggestions, physicians listening to us here today, that you have for physicians to develop their leadership skills, credibility? How did you do that? How do you advise folks to do that?
I think you have to be intentional. I'll acknowledge I've met a couple of physicians in my career that was almost down the line of, I'm ready to be a leader now, put me in coach. And that doesn't work. You have to be intentional and want to actually lean into the skills of leading and be willing to learn that they're very different skills than, operating on a baby's neurological system or, being in an ICU and some of the other things that our physician colleagues do. You have to be intentional and be willing to put the effort in to learn how to lead. And you do that a lot by, being in the room. Being there as a committee, for example, makes a decision on whether you're going to buy a new laser and learning how does how does our organization make that choice? Because if you walk right in and the only thing you know is I like a new laser and the rep told me that this laser is better than the old one, well, then you're always going to want the new laser, as opposed to learning a process that a system, an organization does to make decisions like that. And, at first, listening more than talking. At some point, you need to talk enough to, contribute. Learning from others, to learning, reading your book, for example, listening to things like this, where people talk about what it really means to lead. There's rich knowledge in there, but it doesn't just fall in your brain. You have to actually put that effort in. So those listenings, early on, I subscribed to, my wife actually got me a Christmas present, a subscription to HBR. So she got me a subscription. I read it, started learning about business, learning about leadership. Well, I wouldn't have done it that way. Well, yeah, I wouldn't have done it that way because I didn't understand how complex that, some of these systems are. So that intentionality, and I think a hunger to learn, just a hunger to try to get more information that you can help you then start with the pattern recognition of the leadership pieces, not that much different than the pattern recognition of seeing a child who's starting to deteriorate and the labs are going in a wrong direction. And you learn that pattern recognition, that's a diagnosis that you need to intervene in. There's a lot of overlap there.
Yeah, you don't know what you don't know, to your point, and getting outside your comfort zone and looking at different resources to say, oh my gosh, there's a whole nother realm of expertise and an entire literature out on how to be a better leader, how to know your tendencies in different environments, and how to improve your ability to select a leadership style based upon what's happening around you. And that's really, really critically important. You mentioned the idea of listening. And, I grew up in a residency where we were told we were supposed to be, better radiologists than the radiologists, and better nephrologists than the nephrologists, and smarter administrators than the administrators. And when you start sitting at the table with these really smart folks, you realize that you're not, if you have any humility at all. And
sounds incredibly familiar. I was going
to say we're similar. And so one of the things that the Army taught us at the War College is that, if you're an infantry officer and you go up to the level of battalion command, when you reach battalion command, you've spent 20 years as an infantryman and you are the smartest person in the room. And this isn't unlike doctors who spend all this time learning and becoming, ultimately at the end of a conference, everybody looks to the senior doctor and says, what's the answer? And then when you step to becoming a strategic leader in this, the War College is training you to be a general, where typically every briefing that you get, whoever's briefing you is going to know more about that subject than you do. And you need to not know the right answers, but know the right questions to ask. So enough knowledge to be able to listen to what's going on, synthesize that, and then ask appropriate questions. How does that ring in your experience? And have you felt that during the transition from, senior established academic clinician to healthcare leader and on the executive side?
Day in the hallway, I ran into a physician leader colleague. Both of us were in higher levels of administration in my former organization. And I walked up to him in the hall and I said, I got to tell you today, I felt really good. In the room I was in, I knew more than anyone in there about the subject. And he called me a bad name and he says, you're in the operating room today, right? And that was the day that I knew more than everybody. And to your point,
that's it.
All the other days,
our safe space, right? That's our safe space.
Still my nirvana from time to time. But in most other rooms, to your point, you don't know the most. And so that deference to expertise, getting the right pieces. And the one difference is when you're the senior leader, that you also have a responsibility is that all the different folks in that equation have their own expertise. They all know more than you about the various pieces that they're bringing in. But ultimately, there's times where you have to assimilate all that because they all come from different perspectives and you have to come to the right decision. And back to, I think what you refer to there is taking in that information so that you've at least gotten the benefit of their best expertise to help you make the most integrated decision is one of the key pieces of that.
That is great advice. Thank you very much. Dr. Jones, we have to take a break, but coming up next time on All Physicians Lead, we'll continue our conversation with Dr. Stephen Jones, President, CEO of Inova Health System. He'll share crucial insight about career transitions, why disliking clinical practice is actually not the best reason to move into healthcare administration.
The only person who can take your white coat away is you. We're the state medical board, but we're going to count on that not happening. So I encourage physicians, lean into, you are a physician executive. I think it's important to, though, be a physician executive, not an executive who used to be a physician. That's not to be as compelling.
This has been All Physicians Lead. We can all be better leaders, and our teammates and patients will be the beneficiaries. Go to allphysicianslead.com to unlock your potential, sharpen your impact, and elevate your journey. All Physicians Lead with Dr. Leon Morse is a production of Forbes Books.